फोन आला तर घे हा बट पाटील.
Good afternoon to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker doctor for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Uday Kumar Jadhav. Sir is MBBS, CHIV, PDCR, AFIH, infectious disease consultant, in charge Art Center, LNT, MDACS, Mumbai, owner of Life Care Clinic, Total Care in HIV, AIDS, Aurangabad, Maharashtra. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is mental health and HIV. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Yeah. Good afternoon, everybody. Uh, Today we are going to talk about the important topic, the mental health with related to HIV/AIDS. So, as we know, HIV/AIDS has a stigma, and so does mental health. And when they both combine together, we have a combination in which we are jeopardized to asserting what and how is important and how to work on that. Without wasting our time, we'll first start with the definition of the mental health. So, what is mental health according to the WHO? So, mental health means that a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stress of life and can work productively and fruitfully, and is able to make a contribution to his or her community. So the three important things which come under the definition of mental health are understanding of the self, that is responsibilities of the self. Secondly, to cope with the normal stress of the life. And third, working productively and fruitfully. And fourthly, he should be or she should be making the contribution to her to the community. So the four important pillars of being an active mental health are known, and any of these in which if the person is unable to realize his capability or cope up with the normal stresses, gets irritable, loses temper, cannot work productively, and also cannot make contribution to the community, is antisocial, means is not in a proper mental health. So we will come today with the major factors which impact the mental health. Now, the three common important attributes for this are: number one is the individual attributes and behavior. As we know, people who are having low self-esteem or who are emotionally disturbed or having medical illness, they suffer a lot and cannot contribute to the society or have a productive lifestyle. Also, people who are under various social circumstances, that means if a person is exposed to abuse in a society, or if there is a conflict or neglect from the family, or if the person is having a low income or poverty, doesn't meet the needs, and has work stress or unemployment, can be one of the part of factors which impact the mental health. There are also various environmental factors like poor access to basic services, or if there is injustice and discrimination, or there can be social and gender inequality, and also exposure to war. So these factors impact the mental health and other the well-being of the person. So if the person has a low morale or person has some kind of medical illness, definitely the mental health is affected. So as we know, in HIV and AIDS, people suffering from HIV think they are neglected or they carry some burden that people who might see that if a person is with HIV can have uh, can have some stigma or maybe some kind of unrealistic reasons which can affect the mental health. So these are the factors we should know which are contributing to the health of a person. So how can we see the impact of HIV and mental health? Number one, for the first substance abuse is one of the commonest things that is there in the person who is having this mental health issue. Substance abuse including excessive consumption of alcohol or drugs. It can be tobacco as well as injected drugs. Lot of people who when come to know that they are having HIV and when they are not properly counseled, they turn to excessive drinking. Also, people can also go over to smoking or taking IV drugs. This substance abuse help makes them miserable and they cannot work up or stand up in the facility. They cannot uh, they cannot have moral values in their family, and also they have a lot of other disturbances from the community. Second important part that comes is depression. We're going to talk more about depression, but in short, depression is something when the mood of a person is not happy. A person suffering from depression can lead to various other complications, leading to a lifeless life. Third, which can lead from depression, we go to sleep disturbances. People can become more sleepy or they can also have insomnia. Constant trouble of sleep disturbance can lead to less workability and productivity, and therefore person can have a lot of issues to confront. Then comes the anxiety disorder. People with anxiety, they are unable to focus or concentrate, unable to plan, unable to carry out the work given, and therefore these people cannot have good relationship in the society. They might have issues uh, con- conveying their feelings to their home people in the home family. Also, they cannot accept some kind of courage to understand the situation and work in order. Lastly, comes the post-traumatic stress disorder, in which these people suffer of flashback or bad dreams or frightening thoughts, fear of death, fear of being judged, fear of being punished, are the few things which come to the mind, and hence the total mental health of the person can be affected. There can be two or more attributes also in a person. Example, a person having a substance abuse or alcoholic can lead to depression, can lead to disturbances, sleep disturbances. Also, having anxiety can also have sleep disturbances. And post-traumatic stress disorder is something very commonly seen in patients. When these one or two or more than one disorder is there in the patient, then the person cannot communicate and person remains lonely, doesn't express, and people cannot underestimate the reason of being sad or quiet or staying in a same state all the day long. People conclude or connect HIV or AIDS with death, HIV and AIDS with rejection, HIV and AIDS with all other things that can happen in the future. People who have access to internet, they also indulge in seeing more of videos or uh, reading some kind of material in which HIV is correlated with death or ill health. Lot of the videos that are present on the internet may be of a long past thing when initially HIV was a dangerous disease. This particular impact can lead to stress, leading to all kind of issues which when connected cannot be treated well. People having lot of depression or sleep disorders can lead to anxiety and unable to accept the scientific treatment of HIV. Lot of people care about staging of HIV. So staging of HIV, as you know, stage one, stage two, stage three, and stage four. Stage four meaning AIDS. And then people think that the number of CD4 cells in the body can lead to staging of HIV, which was a part when it was unable to measure the CD4 as well as virus load in the past. But today, with newer drugs, newer medication, we can stage the disease, and a stage 4 or AIDS patient can definitely or surely can change to stage 1, a person who can lifelong take medicines and be treated and be available for health management for a normal life expectancy. So, what are the effects of substance abuse? The substance abuse, there can be poorer health outcomes in individuals with HIV. So, poorer health outcomes are related with if the person is a smoker, then the lungs can be affected or the brain can be also be affected. Secondly, if person is alcoholic, then definitely the person be having some GI disturbances or diet disturbances and also some mental disturbances, which also can lead to increased sexual risk behaviors. As you know, person who is intoxicated can have desires or can have issues having doing sexual risk with multiple partners, leading to more spread of the infection. With a person being alcoholic, there can be poorer treatment adherence. Alcoholic people try not to understand or cooperate, and hence they are they are affected by the mind and they don't want to take the treatment properly. They miss the pills, they don't come for follow-up visits, and therefore this can have a more kind of infection. Also, there can be decreased healthcare utilization. These people don't tend to come up for the clinics or follow-up visits, and therefore can lead to disorders. Also, when a person is alcoholic, he doesn't follow up with the treatment measures or management outcomes. Therefore, these people cannot have the proper management. So, what are the other effects of anxiety disorders and depression? Number one, when a person is having some kind of mental disturbance like anxiety or depression, then there is a reduction in the medication adherence. Adherence is something that has been promoted from long back. People with good adherence are doing well, and people with poor adherence suffer a lot with lot of resistant issues and also some kind of pharmacological issue, which leads to reduction in the metabolism of the drug. Also, there is reduction in the quality of the life as the person is unable to sleep, unable to do things, unable to be fruitful in his life, and also communicate with the peer members or the family members. The person is rejected, therefore is been avoided from other people in society. There is definitely less reduction in the quality of the life. Also, the treatment outcomes are reduced, and so possible worsening and then progression of the disease. So, anxiety and depression should be sorted out or discussed and diagnosed. Most of the patients, when they come for HIV treatment, are feared or are helpless or having on a lot of anxiety since they think they are being judged with their father, with their family members. The wife can judge the husband, or husband can judge the wife, or the son can judge the mother, or son can judge the father, and these kind of things work up. In India, as we are having a society in which the marriages of the children becomes the prime issue for any parent, and the status of HIV in the family leads to issues leading to more of anxiety and depression in the people. Thus, they feel that the disorder of HIV can lead to more complications in life than with the adherence of the drug and treatment with the drugs. Also, there can be other issues in various ways because India is divided into a lot of groups, lot of people having different communities have different issues, and these different issues are not vocal, and they try to worsen the situation and make life more miserable for them. Now, what are the effects of sleep disturbances? As we know, there can be two types of sleep disturbance. One is insomnia, other is having more sleepiness. Also, insomnia and also there is an obstructive sleep apnea syndrome It's commonly seen in HIV infected patients. A person with insomnia is difficult of falling asleep or staying asleep or having unrefreshing sleep. As we know, the sleep, there are two cycles, rapid eye movement cycle and non-rapid eye movement cycle. That is very shallow sleep and deep sleep. When the person is unable to go in deep sleep, the body is unable to refine the process of healing in the body, and therefore the person becomes more of irritable and sleepiness combined with the day. Also, obstructive sleep apnea syndrome is the periodic cessation of breathing during the sleep. These two effects affect the problems of the person of getting from unhealthy way to healthy way or reviving new cells from the body, and thus uh, making the person more of a lazy, more of a disturbed person. Now, what are the effects of post-traumatic stress disorder? The post-traumatic stress disorder, they lead to high rates of non-adherence to the drugs. Secondly, there can be treatment failure and then leading to a poor quality of life. Most of the time, the people who are not counseled or not taking treatment with the HIV physician, they are advised medicine and which they are asked to take them regularly. But when the basic issues of stigma and post-traumatic stress disorder are not looked out, people feel they are being rejected or they are not seen in a proper way and don't understand. People who are in the family, they feel that we are touching each other or been keeping away from others. This can help, this can lead to feeling of worthlessness, feeling of irritation, feeling of depression, and therefore poor quality of life. The important part when coming to the HIV is the depression, and that depression has a deep root with the rate of HIV. Because as you know, there is stigma for HIV in the world, and therefore people feel depressed. Let's see what is the meaning of depression and how it conflicts. So when people feel depressed, they often feel withdrawn from meaningful activities. So a powerful intervention is to reconnect to a source of meaning and engage in activities that are meaningful, such as relationships. So if a husband and wife, one of the person is HIV positive, the person who should take part in the relationship with the wife, with the son, with the daughter, with the other brothers and sisters can help. Also, work or volunteering. If you try to do some kind of physical activity, then the mind and the body connect together. Suppose the people are more not unable to work in a fashion, then they can also go for volunteering. What is volunteering? Volunteering means doing something seva at a place. So if you do a seva or a work in some kind of institute, definitely that can also help. I also advise people who come to me to work. Work means you can go for a training, you go for gardening, you can go for gym, you can go for playing table tennis, badminton, things which are there of doing physical activity. But this kind of work should be a team work. As we know, in a team, a lot of things happen in which people get connected and the relationship develop, the sportsmanship develop, which also helps. The people who are not that much physically active, I ask them to go for volunteering. Volunteering can be any place like cleaning, or they're doing a tree plantation, gardening, or going to some anathalaya, or even going to some old age home, where we can go and work with people. When we see the suffering or the pain in other people, our pain or suffering gets reduced. And that's why we ask people to go and work. Thirdly, we can also go for education or training. Lots of people, they want some kind of education. So the education can be yoga, they can be meditation, or even training. Training can be physical training as well as mind training. Even doing a yoga where we are trained to breathe properly or trained to doing a deep breathing exercises. This can also help in that. Also, we can also go for citizenship or community life, in which we can do what do you call, going to some melas, going to some kind of bazaars, going to hiking or trekking. These kind of things are very powerful, which help to reconnect to source and give meaning or engaging in the activities. Help us to build up the relationship. So as we know, we only have 24 hours a day. Most of the people who plan for years or decades, and they don't understand how to spend those 24 hours of the day that we have. So we have to plan in such a way that we need to give a meaning to a life. So these 24 hours in our in a day, they should be planned. That should be planned early. Before planning, we need to ask few questions to ourselves. The questions are, what really matters to me? So person who is a bread earner, who understands who the daily wages, we think that today I want to earn something so that I can feed the family. A person who is an officer can see how can I do a job so that I can do the purpose of it. So what really matters to me is the question that should be asked personally every day or every night before sleeping. So in the next day, we should understand what matters to me. Secondly, what makes my life meaningful? We should be in charge of our life and we should understand what does my life, what can make my life meaningful. Sometimes we feel money is the only way in which we can make the life meaningful. But lot of gurus and people have told that money is not the only way. There is love, there is companionship, there is working or making something beautiful or doing something that has some kind of impact on the society. So that's those things should be worked up to make the life meaningful. Thirdly, how can I help someone else? Most people who are dejected, who are depressed, they feel that they cannot help some other people. So this something which can help others. We should do this. This can be small things in which we can go. If we greet somebody who is old, who is living alone, if we smile to them, if we go to a people and share their sorrow or their issues in their life, we just go and sit with other people, be their friend. These are the things. This can also help and make others live a peaceful life, leading us to giving us some kind of hope to live a peaceful life. And fourth is how can I use my skills, talents to make a difference. So people have talent. Every person has three skills or three talents hidden in himself or herself. And we should understand that what set of skills I have, what kind of things I can do easily, and what things I can make so that I can put a difference to society. A lot of people it is difficult for them to understand what are skills. So skills is something that when you do for a day long, without any hurdle, without any kind of fatigue, that is a skill. Skill can be talking to people. Skill can be understanding people. Skill can be working something good. Skill can be a lot of things that a person may have. Some can have a skill for painting. Some can have a skill for talking. Some can have a skill for sports. So see what kind of skill set you have. The skill set we have, you should see that what kind of difference that can make to a student. So, so there are various tools for addressing in the primary care, and the number one is the behavior action. Most of the time, what is behavioral activation? Most of the time, we see that the behavior of a person is something that makes it hard for him to live a normal life. So if we change that behavior, definitely we can have a positive role, a positive impact in the other person's life. So what determines the positive role happiness? The happiness we have to find out there are various ways it can happen. So 10% is by circumstances that can happen. That are not that can happen to anybody. This can lead to life. Secondly, we do some intentional activity. And intentional activity are your choices, your actions, your thoughts, which are under your control. And these can also help. And lastly, 50% are genetics. So whenever we try to have a happiness in the life, we should choose. The choices should be yours. Supposedly, you want to have some kind of travel options you have choices like you can walk, you can get a public transport, so you can have your own bike. And the actions to take the particular action to particular type of transportation will make you understand how it goes. This can also have other impact to other things also, like doing work, like doing some recreation, like So doing some kind of activity which will help others. And lastly, genetics. Everybody has very different kind of genetics. Some are tall, some are short in the physical genetics, and some are mentally strong, some are not. Suppose a person wants to travel, and the person sees that he can have should have do a marathon. So doing marathon is a choice. It's an action because a person directly cannot run for 21 kilometers. He has to have a choice. Yes, running is something, and you should start with walking. When you start with walking, then he can jog. After jogging, can go to various stages, and that can lead to more choices, leading to happiness when it completes the marathon. These are the things we should be there. So being happy, we need to have choices, then we have to take actions there, and we have to have thoughts in which we can help get to the determination of happiness. So there are various positive activity models that are there, which helps to have them. The first one, these are connected to each other. They have, if a person has positive emotions, then the person will get positive thoughts. Then the positive thoughts give us positive behaviors, and lastly, need satisfaction. Uh, you might be knowing the movie called Munna Bhai in case, in which the hero or the main person in the main role, Sanjay Dutt, gives Yaduvri Jaffi to a person, anybody who meets, anybody who irritated. Now, what does that do? Positive Jaffi or giving a hug leads to positive emotions. And when you have positive emotions, that leads to positive thoughts, and leading to a positive behavior, and then there is a satisfaction. When you get satisfaction, then there is an increased well-being. The person feels, yes, he is something there. He has some kind of motivation. He is something providing to that community, and therefore having a gets a performance positive activity, which again leads to positive emotions and positive thoughts. So when you have a positive activity model, definitely the person can do positive activities and lead to positive action and a positive performance. So as we know, the depression has some kind of vicious cycle. Vicious cycle when grows, sorry, there is a sad mood, and this sad mood generates low energy, and when there is generate low energy, there can be avoidance of pleasurable activities, and people leave food, people don't sleep, people don't talk to other people, and that leads to social isolation, and this social isolation again leads to a sadness. So the depression spiral is something that we should know. So when a person is having sad mood, we need to break that. Anywhere, person having sad mood, try to go to a happy mood. Try to go to some kind of vacation. Go for a movie. Go for a friend to talk. Go talk to someone. So we have to deal with the sad mood. Secondly, having low energy, go with the friends. Have a stress buster friends. Go for a movie. Go for some kind of comedy shows. Go for some kind of uh, way out of the thing. Go for shopping. This can boost the energy, and that will definitely work. So just find out what kind of activities give you pleasure, what kind of people give you pleasure, and once you delete the social isolation, once you have connectivity with friends, people who have good thoughts and good mood, we can have positive thoughts and positive cycle. So behavior activation BA, that is increasing the enjoyable activities and decreasing the depressive symptoms. So the goal, sorry, to help people engage in meaningful activities that align with their values. And there is low risk and no side effects. So the research shows that behavioral activation is as effective as therapy and medication, and improvements in mood persist after acute treatment has ended. So behavior activation definitely have on the positive effects, long-term effects, which gives meaning to the life. So how can you do that? This the rationale for behavioral activation is in the moment you have to do something that is easy, and when you do the easy things, it gets better in the hard way. The long-term consequences are that if you avoid, then you become stuck. But if you do that, and the rewards and growth are innumerable and invaluable life lessons can be learned. This. What is the role of physician in this? The role is that we should encourage selecting and engaging in pleasant activity. So we should ask a question like, what did you used to like to do? So this particular question asks the person to go in the past and find out the activities or find out the things that help him to be active. Secondly, what were you doing when you were feeling happier? So actions and emotions are together. So any person who's happy can have better actions. So and what gives you a sense of meaning and or accomplishment. So these are the questions that we should ask them, which encourage them to go in some engaging activities. Also, ask the people to help set smart goals. What are smart? Smart means specific, measurable, attainable, realistic, and timely. So anything that is specific, yes. If we have a person working for 1 hour, that is if that gives him happiness, then we should say he should work for 1 hour every day, and that should be done timely. That will help them. Even also encouraging taking small goals like help break large goals to small action steps and take first step that has a high likelihood of success would generate energy levels that will help them to do a better job of fighting depression in people. So these are the issues that are there. That now we should know how to identify the mental health issue. Number one, when a patient comes to you, see how does it feel. If the person feels very sad, doesn't talk to you, or has lot of anxiety and often is irritable all the time, they're frustrated, restless, suicidal thoughts are there. The person is not able to do activities, not wanting the activities, having trouble falling asleep, sleeping or too much, feeling of guilt is there, worthless or helpless. These are the things related to the mental illness. And when a person is having this, person won't feel, won't talk, won't uphold himself person, but identifying the person's activity, identifying the person's behavior can help to find the mental issue. And when the mental issue is found, we need to work fast so that before worsening, the person can get good mental health and come to normal. Now, manage the how can you manage these mental health issues? Managing the mental health issue, number one is sending the person to a mental health professional. As you know, psychiatry, mental health, the important aspect of the health, total health of a person. But in India, we also have stigma for psychiatrists. Psychiatrists are called as pathology doctor, and therefore people who do not go for this doctor's help. But as we know, the person can be educated, uneducated, rich, poor, can land into mental dilemma. Therefore, asking the person, patient, or patient's relatives, because these are the people who try to solve help it, to importance of mental health professional leading to preventive treatment. Secondly, the medication. Medication help in improving the symptoms, and people think that taking medication for mental health for mental issues can increase the dependency of on the medication. But I tell you, medication for HIV patients will, in my experience, when given, they will not give for long term. The amount of medication decreases when they improve. Therefore, medication doesn't go for a long term treatment. Yes, there can be some diseases like schizophrenia or the kind of psychiatric illness they need treatment, but on that treatment, this patient can be a better health. Secondly, there are other therapies like brain stimulation therapy, hospitalization. They have an important impact on the patient and can help. Also, have a support, having support group. People who are alcoholic, we refer them to a group called Alcoholic Anonymous, and this particular group help them to understand their shortcomings in the life, the emotional what they are having, the insight, and therefore these people gain insight into the condition and therefore addressing the feeling of isolation was stopped. They got the help. They are doing better now. And lastly, exercise or yoga, which is a physical activity, and therefore improvement in mental health is there. As we know, physical and mental health are related, are activated by each other. So doing more physical things can help you get more mental peace, more mental activity is definitely work in a positive direction. So in short, how to maintain good mental health. Number one, be aware of your feelings. We should accept that all the time how you feel like. Are you stressed? Are you tense? Are you depressed? Don't pretend to have that having feelings often make things worse. So always be honest with what you feel. Always be honest with what you understand, what you like, and whatever you feel, please share with someone. So speak to someone you trust. You should have some person who you trust, and you should share your feelings with someone and which makes you feel better. Talking about the problems can help you to find ways to solve them because people also might have gone through the same situation. They might have got some kind of issues in their life or they might have heard of that. So speaking to someone opens up their mind, your mind, and help them to understand. Also, please keep doing the things you usually do. The mental routine. The people who don't have a routine, when they don't sleep at time, wake up at time, they do not have a routine, then they can have things that doesn't work. So to help and relax the store, have a break, a weekly break, daily break, and have something that will help you. Also speak to a health worker or counselor. Most of the time, people keep to themselves and don't speak up. But speaking to health worker or a counselor makes you feelings understand. Because if you are stigmatized, if you are not taken care of, you are not talked to properly, there are the issues that can be there, that can deepen, that can worsen, and therefore we can. Lastly, join or start a support group. Go to a group when same kind of problems people have, they share their experiences or find the ways to cope up. We understand how it is working and we can also do the things to find help ourselves. Also, take medications, take them prescribed by the doctor or health professional so that we can remain healthy, stay healthy, and have a healthy life. Thank you very much. This was something I want to share with you about mental health, mental workup, so that we can understand how people can cope up this. I'm Dr. Uday Kumar Jadhav. That's my life care clinic, where we are working to treat and work with HIV/AIDS from last 15 years. We are working hard so that we can provide proper treatment, proper understanding of the disease, and also give them a light to their lives. Thank you very much.
Thank you so much, sir, for your wonderful presentation. So we have some questions from our audience if you'd like to take that up.
Yeah, madam. Just a minute. I will.
Sure, sir.
Yeah, ma'am.
Thank
Hello.
you, sir. Yes, sir. So, sir, the first question is, how do you collaborate with mental health professionals in managing patients with both HIV and mental health condition?
Yeah. So uh, initially, when I was treating HIV in the initial years, it was difficult to diagnose and treat patients. But when I found out few patients definitely need mental health support, then I approached psychologists, psychiatrists, and then we presented with the patients and we discussed the cases. So there are a lot of issues or diseases that can be comorbid condition for people, which can be prior to HIV infection. So people in India, they have issues which work up with them and they do not get proper treatment for that. Since mental health is also a part which is unregulated, untreated, the people have issues. So what I do, I refer the patients, people with having mental issues to my psychiatric colleagues who intervene, do their best, and now we are getting good results with the patients with having treatment with the psychiatrist.
Thank you, sir. So, sir, the next question is, In your practice, how do you incorporate trauma-informed care principles when managing patient with both HIV and mental health issue?
Can you repeat the question? Trauma?
Sorry. So the question is, in your practice, how do you incorporate trauma-informed care principle when managing patients with both HIV and mental health issues?
Okay. So people who are having some kind of trauma, then we take the history of the patient. And after taking the history, we get the assess, patient get assessed. After that, we share the patient with the psychiatrist. We hear the history of the patient with psychiatrist, who use the principle of psychiatry, getting the issues the person and in the mind. We treat them with the psychiatric medications and also follow up with issue. The person who is having some kind of substance abuse issue, then we have other team which helps the person to get some kind of help in those particular fashion, and thus asking the person to get a better way.
Thank you, sir. The last question from our audience is, how do you address substance use disorders in HIV positive patient with mental health concern?
Yeah. So substance use disorder is very common with HIV patients. So whatever part, most of the times we have alcohol. So we send the patients to alcohol de-addiction center and then work towards the base of the issue. There are two types of issues. Number one, if the person is having direct substance abuse, then after de-addiction treatment, the person can cope up with the issue. Secondly, people have issue with HIV and they then start to drink. This particular type of management can be worked on with making them patient understand the importance of treatment of HIV, coping up with the stigma of HIV, and managing the what do you call so conditions with the family or members of the community, in which they understand that HIV/AIDS is not a death sentence. HIV/AIDS is not something that would be hard for them to manage. So the newer medication, newer treatment help people to stay healthy, to stay strong, which makes them adherent to the treatment. And when the patient becomes adherent to the treatment, the person can have a better lifestyle, better behavioral pattern, and also have hope for the future. This helps us to treat them in a proper medical way.
Thank you so much, sir, for answering all our questions and joining us today. Before concluding today's session, any last remark from you?
Yeah, people think that HIV/AIDS with mental health is a difficult part to treat, but I would like to share that we have solved a lot of difficult patients and different treatment. I also have teamed up with two psychiatrists, and now we are having a new mental health HIV forum for us. We are going ahead with the Manashakti Clinic, in which we are trying to find out the various issues related to mental health and HIV and which can be solved. We are planning to get the scientific data and to get persons treated with mental health and HIV in a new active way with us. So if you want to have more, you can contact me. We can work on that.
Thank you so much, sir, for joining us today again. And with your permission, I would like to conclude.